Hey guys, welcome back to the channel. If this is the first time watching one of my videos, my name is Kiran. I'm a junior doctor and a comedian working in Manchester. As always, if you are new, make sure you're subscribed so you can join the team. The training program for doctors is a sort of escalator that it's quite difficult to get off. Once you've got into medical school, you go through medical school, you finish and do your foundation training. As a training doctor, you progress year on year and year, and it's difficult to stop, look back and reflect on what you've done already. If I could go back to medical school, there are definitely some things I would have thought about differently and done differently. So in this video, I'm going to talk about things I wish I knew before medical school. Now, without any more delays, let's get into it. The first might sound quite silly, but it's important to remember that there is no transition period between being a medical student and being a doctor. You go from being a medical student, having no responsibility and shadowing all of the time, to the next day being a doctor, having loads of responsibility and not being alone because there are people that are able to help you, but at the same time, you are pretty much thrown into the deep end. If I could go back to medical school, I think I would have appreciated that more, and in my last few years, make a concerted effort to learn exactly the job of a doctor and to know what they are doing. So to do that, what I would have done probably is go on more on-call shifts, because that's the thing that when I started as a doctor, I wasn't really sure about. You should, as a final year medical student, basically pretend you are a doctor and do everything the doctor is doing, and that's going to really prepare you well for when you qualify. It's also so easy to get caught up in all the exams you have, in all the preparation that everyone is doing for these exams, and you sometimes forget that you are learning to be a doctor and not learning just to pass an exam. So although books and facts are really important, to learn on the job and to actually be on placement is also really helpful. The second thing I probably would have said to medical student Kiran is medicine is not life. Like I said before, it's very easy to get caught up in the revision. Everyone is working so hard and some people are working all of the time, but you have to also remember that there are things outside of medicine, both to continue your outside interests so you can excel in something else, but also to have that balance in your life and to make sure that that work isn't going to burn you out. Gone are the days of paternalistic medicine where doctors tell patients you have to do this, you have to do that, and they listen to the doctor, and the doctors are there 24 hours being on call, and those days are over. There's a new generation of millennial medics that want more from life than being a doctor, that want to be a doctor, but also live that holistic life of doing other things. So please remember that if you are going to train to be a doctor, or if you're already at medical school, that medicine is fantastic, but medicine is not life. The next thing I probably would have said to myself is that it's impossible to know everything. There are people that have been learning and studying for absolutely years that still don't know everything. And although it's fun to learn these little random facts that may come up in an exam once or twice, the core things are the things that you should be focusing your time on. The phrase that they say a lot is common things are common. That phrase used to really annoy me, but actually that is really accurate, both for exams because they are common questions that come up in exams, but also for being a doctor on call, you need to be able to know how to manage things like heart attacks, pneumonia, acute kidney injury, how to assess a patient that has a fall. Those are the core, the key things that you see so often and that you should know like the back of your hand. Focus on those, you'll pass your exams and you'll be a better doctor for it, I promise you. Next up, I would have said that the basics are so important. It's easy, like I said before, to do these exams and think, I am working to pass this exam in anatomy or physiology. But at the same time, you have to keep in your mind the bigger picture, which is you're learning to be a doctor, and these exams are actually the foundation blocks of future knowledge. So rather than learning first year content for first year, you should be learning in such a way that you are able to consolidate that knowledge, and really anatomy and physiology, having a good understanding of those, I genuinely think does make you a better doctor. If I could go back to medical school, I would have definitely paid more attention to those things, and although I learned them at the time because I wanted to pass the exams, I would have learnt them in such a way that I carried on with that knowledge. I would have used active recall, spaced repetition, still had my notes about them, so every so often you can just top up that knowledge. It's useful both for working as a doctor to understand disease, and also for when you do exams in the future. So you will keep doing postgraduate exams in which you will need some of that knowledge. If you want to know more about active recall and spaced repetition, I have a whole video about it which you can check out. And if you want to know anything in particular, feel free to drop me a message on Instagram and I'll reply to every single one. Next is quite a silly one because we know it, but at the same time, it doesn't always hit home before you're at medical school, is the time commitment that being a doctor is. So you do 5 years at medical school, which are obviously a lot of work, and then you work as a doctor. And I'm not talking about the time commitment of being a doctor in the first couple of years. I'm talking about that when you've done that, you then train to become a consultant. And that training to become a consultant after your foundation years is going to take around 9 years. So that's 9 years in which you're going to be doing weekends and nights and evenings. So you just have to remember and appreciate the fact that in your mid-30s, it's likely that you will still be doing night shifts and evenings and weekend shifts. And you may have a house and a mortgage and a wife and children. So when we talk about medicine as a life commitment, it's not just for the 25-year-old who's doing some nights and covering the wards, which is really exciting. It's about the 35-year-old who has children and other commitments that is also doing these same night shifts. So just something that is quite far ahead, but something that I'm now at a stage that I have to think about. There are obviously other specialities that don't involve those things, like I'm training to be a GP, but if your ambition is to become a hospital consultant in medicine or surgery, then you will have to think about that sort of thing in the future. I also probably would have said to myself that it really isn't as hard as you think. If you're just learning the things you need to know and learning the important things, you don't need to spend every second of every day revising, like a lot of people do. Everything you do is harder than the next thing. GCSEs are hard until you do A-levels. A-levels are hard until you're at med school. First year is hard until you're in fourth year. Like everything that you do does get harder. So you have to remember that so many people in the past have passed these exams and they've put in the work and passed the exams, that you can also do that too. Take regular breaks, have other activities that you can also do that are not medicine, and put in a decent shift, but not every single hour of every single day, because I don't think it's a healthy way to live your life. The final thing I probably would have said to myself is that being a doctor is not the only outcome of a medical degree. And I know that it's quite a controversial thing to say, but it's something that I think needs saying because a lot of people don't talk about it. I know that in the UK, that is the thing that everyone does. You finish medical school, you enter foundation training, and yes, in my opinion, that is the best thing to do. But if you've started a medical degree and you're not sure medicine is for you, what I probably would do is carry on with a medical degree, finish the degree, and then at that point assess if you want to carry on work as a doctor or if you want to work in something else. You can use that as a science degree to work in a lab, to work in other scientific fields, to work in research. You can also do something completely different. You can do accountancy exams and come into accounting. You can do law conversion and do law. I know people that have gone to work at drug companies. Honestly, there are loads of things you can do with a medical degree. Just consider it a really strong degree, probably equivalent to a degree and a master's or a degree with a PhD, just a really strong degree that you can use to do anything. So don't get too bent up on, is medicine for me? Should I be doing this? Should I not? Just crack on, finish your degree. There are other options should you choose not to be a doctor. that people don't really talk about. So just something I probably would have told myself. I hope you enjoyed this video, guys. As always, if you're not subscribed to the channel, make sure you hit that subscribe button so you can join the team. Take care, everyone, and stay safe.